Okay, welcome back. In this video, we will discuss the gastrointestinal system, fuel for the trip. A brief introduction to this chapter. The gastrointestinal system has the following functions: to take in or to ingest raw materials, to break down or digest those raw materials into usable elements, breaking them down both physically and chemically, absorb elements, and also to eliminate what isn't usable by the body. Now, these functions are accomplished through an array of main and accessory organs, with food traveling through what is essentially one really long open tube until products are eliminated. The learning objectives for this chapter: locate and describe the functions of the main organs of the digestive system, differentiate between ingestion and digestion, and also between mechanical and chemical processing of food, be able to trace the journey of a bolus of food from the mouth down through the anus, be able to discuss the structure of teeth, to be able to identify the layers that make up the walls of the alimentary tract, be able to describe the various enzymes and chemicals that are needed for digestion, be able to locate and describe the function of the accessory organs in digestion, and lastly, describe some common disorders of the gastrointestinal system. We'll start with a system overview. Digestive tract, often called the alimentary tract or alimentary canal, is a muscular tube that contains the organs for digestion. Now, the tube begins at the mouth and it ends at the anus. Then between these 2 points, you'll find the pharynx, which is your throat, the esophagus, stomach, small intestine, and large intestine. The accessory organs that are involved with digestion include the teeth, the salivary glands, the liver, pancreas, and the gallbladder. Here's a general image of the digestive system, starting with the mouth, down to the esophagus, down to the stomach, small intestine, large intestine, out through the anus. All of that is one continuous open space, one long tube. And accessory organs includes the liver, gallbladder, pancreas, salivary glands here, and the teeth. All right, now we'll talk about some functions of the gastrointestinal tract. The first one, ingestion. This is when the food enters the mouth, so food going into the mouth. Another function would be chewing of that food, or mastication. It's the mechanical grinding of the food with your teeth and tongue. It's also when you add saliva to the food that you're chewing. It's mastication. Digestion. This is the chemical breakdown of the food into small molecules. Secretion. It's the release of acids and buffers and enzymes and water in order to help aid the breakdown of food. Then you have absorption. As the food passes through the lining of the digestive tract, some things will be absorbed. The things that your body will need will be absorbed. And of course, the last step, excretion or defecation. Whatever your body can't absorb or doesn't need or want will be eliminated as waste products. All right, we'll start with the oral cavity and work our way through the system. The oral cavity is the opening behind the mouth. The hard and soft palate is found in the roof. The tongue is the floor of the oral cavity. And then the cheeks are the walls of this cavity. And the uvula will aid in swallowing and also to direct food toward the pharynx, and then blocking food from entering your nose. And the mouth will receive, taste, and mechanically break down food, and also will begin the breakdown of starches. So digestion actually starts in your mouth. Yes, it takes place in your stomach and your intestines, but the process of digestion actually begins in your mouth when you first start eating. The tongue. The tongue's base, the area of attachment, and the uvula are the barrier to the next part of the system, the pharynx. See, swallowing. See, the uvula will aid in swallowing, directing food toward the pharynx, so it doesn't go back up through another direction, go back up through the nose. See, and as you swallow, your tongue will push the food that you're swallowing into a ball-like mass, and that mass is called a bolus. So at this point, it's able to be swallowed and be passed down to the next part of the system, which is the pharynx. Your tongue will also provide a taste stimuli to your brain, which will help determine temperature and then also to manipulate food. Then there's a membrane that's found underneath your tongue called the lingual frenulum. And this membrane is what keeps you from swallowing your tongue and also aids in speaking. So this helps to anchor your tongue down to the floor of the oral cavity. Here's the image of the mouth and the oral cavity. Of course, the upper row of teeth here, lower row of teeth here. The tongue is kind of pulled upward slightly. The uvula and the back of the throat here. The soft palate, hard palate. There's a profile view of the mouth and oral cavity. This is the tongue kind of slightly pulled up at an angle. Mouth here. Examples of the teeth here. The nasal cavity is above it. The uvula being right here. Alright, now we'll talk about a clinical application for the sublingual medications. Now the area just under the tongue has a large number of blood vessels. So this sublingual blood vessel network readily absorbs substances as a means of rapid absorption and a way to rapidly administer medications. Now one medication given by this route is nitroglycerin, which is used to treat angina or pain. Now angina will develop as a result of poor oxygen supply to the myocardium because of a diminished blood flow. Now, nitroglycerin will help dilate arteries, which will improve the blood supply and oxygenation. And of course, all this will hopefully relieve the symptoms of the angina. I'm moving on to another structure within the oral cavity, the salivary glands. These are an accessory organ in the system. There are two pairs of the salivary glands that are controlled by the autonomic nervous system. You will find a large parotid salivary gland, which is found just anterior to each ear and just slightly inferior to each ear. And these are the ones that swell whenever you get mumps. The sublingual salivary glands are found under the tongue. The submandibular salivary glands are located on both sides of the inner surface of the mandible, near the lower jaw. And the ducts from these glands will empty into the upper portion of the oral cavity. So these are the glands that will secrete saliva, which will start the chemical process of breaking down the food that you're eating. Now these glands will produce between 1 and 1.5 liters of saliva every day. And small amounts of saliva help to keep the mouth moist, but the idea or presence of food can increase its production significantly. So if you think of your favorite food, or you smell something that smells really appetizing, your mouth will water, all due to the increased production of saliva. Now saliva is 99.4% water, but also within saliva you'll find antibodies and buffers and ions and waste products and also enzymes. Now one enzyme, salivary amylase, speeds the chemical activity of breaking down carbohydrates. And then after eating, the saliva will cleanse the oral surfaces, reducing the amount of bacteria that can grow in your mouth. Here's an image of the locations of the salivary glands within the oral cavity. Here's your ear, and just in front of the ear, just inferior to it, the parotids, the largest of the salivary glands. You have the sublinguals just below the tongue, and the submandibulars on either side of the lower jaw. Alright, now we'll move on to teeth. Alright, the first set of teeth we have, the primary teeth, are also called the deciduous teeth. And as we get older, these will fall out because they are pushed out by our adult teeth. The first tooth that we have generally appears around when a baby is 6 months old. The lower central incisors appear first, and then all 20 teeth in our primary set of teeth are in place by age 2.5. Between the ages of 6 and 12, these teeth will fall out and are replaced by our adult teeth, our 32 permanent teeth. And our wisdom teeth will appear by the time that we are 21 years old. Right? There are various different types of teeth depending on their function and their shape. The first one, incisors. These are located at the front of the mouth, are blade-shaped, and are used for cutting food. Canine teeth are used for holding and tearing or slashing of food, also known as cuspids or eye teeth, and they're located right next to the incisors. Bicuspids, or also known as premolars, are transitional teeth, and molars are the ones with flattened tops, and both bicuspids and molars are responsible for crushing and grinding food. I'll now talk about some tooth anatomy. Teeth will have a crown, a neck, and a root. Now the crown is the part that you see sticking out of the gum, and normally is covered by the hardest biologically manufactured substance that's known as enamel. Now the neck is the transitional section that leads to the root. Now internally, most teeth are made up of a structure called dentin, which is a mineralized bone-like substance. And the layer more internal to that is the pulp, which is found in the pulp cavity. Now this pulp cavity will contain blood vessels and nerves, providing nutrients and sensation. Now the nerves and the blood vessels get to the pulp cavity through the root canal. Now the root is nestled in a bony socket and is held in place by fibers of the periodontal ligament. In addition, cementum, which is a soft version of bone, will cover the dentin of the root, which helps to secure the periodontal ligament. Now healthy gums, or gingiva, help to hold the teeth in place, and there are some epithelial cells that help form a tight seal around the tooth to prevent bacteria from coming in contact with the tooth's cementum. Here's an illustration of both deciduous in adult teeth, or baby teeth in adult teeth. The central incisors here, the teeth that baby normally get first, the ones right in front. Then they have cuspids and molars. Same thing on the bottom. Then for adult teeth, incisors, cuspids, premolars, molars, and wisdom tooth. Same thing on the bottom. Their shape is an indicator of their function. Are they going to be grinding teeth? Are they going to be cutting teeth? Are they going to be holding teeth? A focus view on this one tooth. The crown is the visible part of the teeth that we see when someone smiles. And below that is the neck, and then the root. More internally, the enamel is the outside, very, very hard covering. Dentin is a layer just below that. Then the pulp, where you find all the nerves here. So whenever you have a cavity, the reason why it hurts so bad is because it's reached this part of the tooth. The gingiva, or the gums. Periodontal ligament here, and the cementum just inferior to that here. Then the root canal here, way down at the bottom. And the various shapes of each type of tooth. The incisors, the cuspids, bicuspids, and molars. The shape indicates what they will do to food. Alright, now move on to the next section of this gastrointestinal tract, the pharynx. And the pharynx is just a general term for your throat. There are 3 parts to the pharynx, and the name indicates where this area is found. See, the first part, the nasopharynx, this is just behind the nasal cavity. Naso is a reference to nose. It's primarily a part of the respiratory system, and this is going to be blocked by the soft palate. The oropharynx is just behind the oral cavity, because oral is a reference to mouth. And the laryngopharynx is right near the larynx, or the voice box. And these act as a passageway for food and water and air. So if you're breathing air, the air gets directed to the trachea and then goes on into the lungs. If you're swallowing food or water, that food gets diverted to the esophagus to go on to the stomach. Alright, the epiglottis is a piece of cartilage that will cover the trachea to prevent food from entering the lungs and forcing food into the opening of the esophagus. Whenever you eat too quickly or eat too much, or possibly both, when you start to choke on food, people say that you have food going down the wrong way, and that's literally true. You're having food go past the epiglottis as is trying to get into your lungs. That's why you start to cough so violently. It's to dislodge that food and get it away from your lungs, get it away from your trachea. Alright, after the pharynx, the food that you swallowed, or that bolus that you swallowed, will now travel down the esophagus. The esophagus is approximately 10 inches long, and it's connected to the stomach, and normally is collapsed. It only is forced open as a bolus travels down it. So compare that to the trachea, which is always held open constantly by rings of cartilage. The esophagus is a collapsible tube. It extends from the pharynx through the thoracic cavity, through the diaphragm, and connecting to the stomach and the peritoneal cavity. Now there are rhythmic contractions called peristalsis that help push the food down the esophagus. And you'll see that term come up again, peristalsis, in several body systems. Now the walls of the esophagus will be lined with stratified squamous epithelium. Now you want this area to be thicker for protection, because as you have a bolus traveling down, if the walls of the esophagus are too thin, they would suffer a lot of damage every time that you swallowed anything. The outer layer of the esophagus is adventitia, not serosa. There's a muscular ring at the top of the esophagus called the Pharyngoesophageal Sphincter, and when it relaxes, the esophagus will open so food can enter. Now at the other end, there's a similar structure called the lower esophageal sphincter, also known as the cardiac sphincter. And when this relaxes, food is allowed to enter the stomach. And then as it closes, this will prevent the contents of the stomach from going back into the esophagus. So anytime you see the term sphincter, that is a circular muscle that's used to open and close a pathway in and out of a structure. So this is why you're able to eat lunch, stand on your head, and food won't leave your stomach and enter back into your esophagus. So this prevents stuff from going the wrong direction. Alright, here's the movement of a bolus of food going from the mouth to the stomach, through the esophagus. You have the tongue here, and this is the bolus that you're eating. So whenever you swallow, the tongue will force down the epiglottis down, because this is your trachea. You don't want food going down this way, because that will obstruct your airway and make you start to choke. As it travels down the esophagus, here, it will go just beyond the diaphragm, and then here's the lower esophageal sphincter, is normally closed to keep the contents of the stomach within the stomach. The bolus will make it open, and as the bolus enters the stomach, this closes again. Alright, now we'll talk about the walls of the alimentary canal. The innermost layer, the mucosa layer, will line the lumen of the canal. And this layer is composed mostly of surface epithelium with some connective tissue, and has a very thin, smooth muscle layer that surrounds it. And the mucosa will possess cells that will secrete digestive enzymes to break down foodstuffs, and then goblet cells that will secrete mucus for lubrication. So the mucosa layer will help make mucus in order to protect the tissue below it, and also to lubricate the food as it travels by. The next layer is the submucosa. This layer is composed of soft connective tissue, and here's where you'll find blood vessels and lymphatic vessels, lymph tissue, which are called Peyer's patches, and also the nerve endings. Next layer, muscularis externa, the muscular layer. You'll have two types of smooth muscle. The innermost layer of muscle will encircle the canal, while the outermost layer is longitudinal in nature. So this will lie in the direction of the canal. The outermost layer, the serosa, is composed of a single thin layer of flat serous fluid producing cells that are supported by the connecting tissue. And the serosa is the visceral peritoneum of most of the canal. Right here is a close-up image of the different layers. So we start with just one small piece of the canal here. We were to peel back layer by layer. Of course, the outermost layer, the serosa. The next layer will be the muscular layer, the muscularis externa. And you have two different types of muscle, because they're lined up in different orientations. You have the longitudinal layer here, which will go in the direction of where the tube is going at that point. And then the next layer of smooth muscle will be circular. This will wrap around the entire canal. The next layer beyond that, you have the submucosa. And the next layer beyond that, the most internal, the mucosa. And now to move on, talk about the peritoneum. Now, the peritoneum is a serous membrane in the abdominal pelvic cavity. And the visceral peritoneum covers the organs, and the parietal peritoneum lines the walls of the abdominal pelvic cavity. And this came up in a previous video. The terms visceral and parietal are not specific for any one body system. They are general anatomy terms. Anything that's visceral will line organs directly. Anything that's parietal will line a cavity. So visceral peritoneum will line the organs of the peritoneum, and the parietal peritoneum will line the abdominal pelvic cavity. Now between these layers is a fluid-filled potential space called the peritoneal cavity. Now the peritoneum is different from other types of serous membranes. Some abdominal organs are not surrounded by the peritoneum, and these are called retroperitoneal organs. A good example of those are the kidneys. They lie behind the peritoneal cavity. And the peritoneum has several extensions called mesentery that will drape over the abdominal organs. Alright, now we've passed the esophagus. Now we're into the stomach. The stomach is located in the left side of the abdominal cavity, just under the diaphragm, and it's covered completely by the liver. It's approximately 10 inches long, and the diameter will vary depending on how much food you've eaten. Now it can hold up to 4 liters when it's filled, and there are gastric folds that allow the organ to expand as needed. These gastric folds are called rugae. The stomach has 4 main functions. The first one, the temporary holding area for food. It also will secrete gastric acids and enzymes that will mix with the food and performing chemical digestion. It also helps to regulate the rate of new partially digested food, and as it enters the small intestine, the semi-fluid paste is called chyme. It also will absorb small amounts of water and substances on a very limited basis. The stomach is a very harsh environment, so it doesn't really absorb that much of anything. Now, the stomach is divided into 4 regions. Near the heart is the cardiac region, just near the cardiac sphincter, or the lower esophageal sphincter. The fundus, which is a temporary storage area for food as it enters the stomach, is laterally and slightly superior to the cardiac region. The main portion of the stomach is called the body, and there are 2 curves. You have the lesser curvature, which is concave, and then the greater curvature, which is a larger convex curve. Then the end point of the stomach is called the pylorus. This is a funnel-shaped structure. Now, most of the work of the stomach is performed here in the pylorus. This is what controls how much material enters through the pyloric sphincter to enter the first part of the small intestine. Here are those 4 areas. Of course, you have the esophagus here, cardiac sphincter, or lower esophageal sphincter here. So the cardia would be here. You have the fundus here. Body is the main portion of the stomach, which includes the lesser curvature here, then the bigger curvature, which is a greater curvature here, then the pylorus here. And what controls what or how much material leaves the stomach is the pyloric sphincter here. Now we'll talk about the muscle layers of the stomach. The muscular action of the stomach works like a cement mixer, basically churning material around, adding it with digestive enzymes constantly. The more it churns, the more surface area can be exposed to these enzymes and acids, so more can be broken down more quickly. And this is done by 3 layers of muscles. You have the longitudinal layer, the circular layer, and the oblique layer. Now, the stomach will work the food toward the pyloric sphincter through peristaltic activity of the muscles, basically a wave-like motion moving material forward. Now, it takes about 4 hours for the stomach to empty following a meal. Of course, that will vary depending on the food that you've eaten. Liquids and carbohydrates pass pretty quickly. Proteins take a little bit more time to get through the process, and then fats take the longest, usually between 4 to 6 hours. Alright, now we'll talk about gastric juice. Now, gastric juice is not just one item, it's a combination of multiple secretions by multiple kinds of cells. It's a combination of hydrochloric acid, pepsinogen, and mucus. Now, pepsinogen is secreted by the chief cells. Hydrochloric acid is secreted by the parietal cells, and when those two are mixed, pepsinogen is turned into an active form called pepsin. This is the main digestive enzyme. So pepsinogen, when normally secreted, is an inactive enzyme. It can't do anything until it gets mixed with hydrochloric acid. And pepsin will break down proteins, and hydrochloric acid will break down connective tissue. Hydrochloric acid is also a very strong acid. It has a pH of between 1 and 2. This can cause a chemical burn on your skin, which is why it's so effective at killing pathogens. It's also why heartburn hurts so much. When this acid goes beyond the cardiac sphincter and into your esophagus, it's literally burning through that tissue. That's why it's called heartburn. Now, the mucus cells will generate a very thick layer of mucus that will help protect the stomach and stomach lining from the effects of such a strong acid. And the stomach will also secrete intrinsic factor, helps the intestines absorb vitamin B12. Here's a table with the gastric glands and their functions. The chief cells make pepsinogen. When that gets activated into pepsin, will begin the digestion of proteins. The parietals will make hydrochloric acid and also intrinsic factor. Mucus cells will make mucus, and the endocrine cells will also make a hormone called gastrin. Alright, now we'll move on to the control of the stomach action. Now, the stomach's activity is controlled by the parasympathetic nervous system, and in particular the vagus nerve. Now, the vagus nerve is what will increase the motility of the stomach and also the secretory rates of the gastric glands. Okay, there are 3 phases to gastric juice production. The first one, the cephalic phase, and this is due to the sensory stimulation, the sight of food or the smell of food. This will stimulate your parasympathetic nerves through your medulla oblongata to release gastrin. This gastrin will travel through the bloodstream and will reach the stomach, which will stimulate gastric gland activity. Our next phase is the gastric phase. 2/3 of the gastric juices are secreted as food enters the stomach and distends the walls, which signals the stomach to secrete even more gastric fluid. And the last phase, the intestinal phase, where food will leave the stomach, entering the duodenum, the first part of the small intestine. So as this food leaves the stomach to enter the intestine, this will slow down gastric gland secretions, and this will continue until the last bolus leaves the duodenum. Cephalic, gastric, and then intestinal phases. Seeing and smelling food, then actually getting food into your stomach, and then passing that food on into your intestines. Here's an image of those 3 phases. Sensory stimulation, seeing food, smelling food, tasting food, or even thinking about food. That's the cephalic phase, which will cause the medulla to stimulate the vagus nerve, which will cause gastrin and the gastric glands to increase. That will lead to the gastric phase, where food is actually into the stomach, which will distend the walls of the stomach, which will cause gastric juice to increase even more, which will lead to the intestinal phase. As the bolus leaves the stomach, that will decrease the distension of the walls of the stomach, which will lower gastric secretions. Because there's no need to make gastric secretions if there's nothing to digest there. Control of the stomach action. Now, the rate of the movement of this semi-fluid paste called chyme is very important. You can't have all the material in your stomach trying to enter the small intestine all at once. it would be just too much to handle. There has to be a way to regulate how much enters and how quickly. If it moves too slowly, the rate of digestion and absorption will be decreased and may allow for the acidity of the chyme to cause erosions of the stomach lining. If the chyme goes too quickly, the food particles may not be sufficiently mixed with the gastric juices, leading to insufficient digestion. And the chyme that isn't given time to neutralize can cause erosion of the intestinal lining. Remember where chyme is coming from. Chyme is coming from a very acidic environment. It has a pH of between 1 to 2. You can't have something that acidic entering the small intestine. There has to be a way to neutralize that before it gets to the small intestine. And we will talk about that a little bit later on. Alright, small intestine. Small intestine is located in the central and lower abdomen. This is the main organ of digestion because this is where most of your food gets absorbed. And all the parts in this chapter that we'll talk about have an important role, obviously. And most people think that the stomach is the biggest player in the system. But the chief player of the digestive system is the small intestine. Now, the small intestine may be small in diameter, but not in length at all. This is the longest section of the alimentary canal, with an average length of about 20 feet, and the diameter will range depending on what it connects to. It can be 2.5 centimeters where it meets the large intestine, and it can be about 4 centimeters where it meets the stomach. Here's the stomach here. At the first part, the duodenum, or duodenum, that leads to the jejunum. And the last part will be the ileum. And this part will attach to the large intestine. All right, we'll talk about the function of the small intestine. Now, the walls of the small intestine will secrete digestive enzymes, which are important for the final stages of the chemical breakdown of food. They will also secrete hormones that will stimulate the pancreas and gallbladder to act, and also will control stomach activity. Now, secretin is one of these hormones that will stimulate the pancreas. Now, 80% of the absorption of usable nutrients occurs when chyme first comes in contact with the mucosal walls of the small intestine. So amino acids, fatty acids, simple sugars, vitamins, and water are all absorbed here. And the remaining 20% is absorbed in the stomach. Now, any residue that is not utilized in the small intestine is moved on into the large intestine to eventually be removed or defecated from the body. Now, there are 3 regions of the small intestine that we saw on the image. The duodenum is about 25 centimeters long. It's located near the head of the pancreas. And the term duodenum or duodenum gets its name from duo, which means 2, and denum, which means 10, which equals 12. 2 plus 10. This number is the number of finger widths that the organ is. So it's about 10 inches. The next section, the jejunum, is the middle section. It's about 2.5 meters long. So it's about 7 feet long. And then you have the terminal end is the ileum, which is about 2 meters long, which is about a little over 6.5 feet long. And this will attach to the large intestine at the ileocecal valve. All right, now we'll talk about duodenal function. The pyloric valve is important. We mentioned this before because it allows how much chyme is allowed to enter the duodenum. Because the small intestine can only process a little bit at a time. All right, this is done through muscular action. Now, the muscular action of the duodenum will work in 2 different ways. You have segmentation. This causes the mixing of chyme and digestive juices like a cement mixer, while peristalsis moves the food toward the large intestine. Now, the pancreas and the gallbladder will also add secretions into the duodenum. You'll get bile from the gallbladder and liver, and then pancreatic juice from the pancreas. The bile will work to emulsify or break down fats into usable forms, making the fat disperse in water. When you emulsify fat, you're turning it into basically water droplets. And then the pancreatic juice will contain bicarbonate, sodium bicarbonate ions, which will help neutralize the acidic chyme, so your small intestine is able to handle the acidic nature of it. And what this does is, bicarbonate ion has a very high pH. You mix that with the very low pH of chyme, and you get a more neutral solution, something more tolerable to the small intestine. So the bicarbonate ion acts as a buffer system, turning something that's normally a strong acid into a weak acid. Some various hormones you'll find the duodenum, cholecystitis, which is usually abbreviated CCK. This is secreted by the small intestine, and its function is to stimulate the gallbladder, and also stimulate the pancreas, and also to slow stomach activity. Another hormone that you'll find here, secretin, will be secreted by the small intestine. This will stimulate the liver and also the pancreas, It will also slow down stomach activity, because remember the small intestine can only handle so much at a time. Some digestive enzymes, they'll be intestinal and also pancreatic. The mechanical and the chemical irritation of the acidic chyme, plus the distension of the intestinal walls, creates the localized reflex action and causes the release of the enzymes of the two hormones. Here's a list of the hormones found in the digestive process and what organ they're from and their action. Gastrin is made by the stomach, which will cause the release of gastric juice. And the more gastric juice you have, the more quickly you're able to digest the food that's there. Secretin, this is secreted by the duodenum. This will stimulate the release of bicarbonate ion from the pancreas and also bile from the liver. This will also slow down stomach activity. And then you have CCK, also secreted by the duodenum. This will stimulate the release of bile from the gallbladder, and it will also act to slow down stomach activity. All right, now we'll move on to the walls of the small intestine. There are some modifications done to the small intestine, and these are mainly done to increase surface area. There are circular folds in the small intestine called the plicae circulares, and on these folds you'll find finger-like protrusions into the lumen called villi, and each villi has extensions on top of that called microvilli, and all this is done to increase surface area. Each villus contains a network of capillaries and lymphatic capillaries called the lacteal, and the intestinal glands are located in between the villi. So the more area that you have spread out between the villi and the microvilli, the more material you're able to absorb at a much higher rate. Now these capillaries will absorb and transport nutrients to the liver for further processing. The lipids will become chyle and are absorbed by the lymphatic system. Now these villi are also very tightly packed together, giving it a very velvet-like touch and velvet-like appearance. And like I mentioned earlier, the villi have outer layers of columnar epithelial cells are called microvilli. So if you were to zoom in just on one area of the small intestine here, it would look like this. And you still have the four walls, or the four layers, that's found throughout the alimentary canal: mucosa, submucosa, muscular layer, and serosa. So if we zoom in just on this one piece here, each one of these projections is a villus. So within each one you'll find a network of capillaries and then a lymphatic capillary, which in the intestines is called a lacteal. You also find Peyer's patches scattered throughout the intestines. Then on each one of these villi, you have microscopic extensions called the microvilli. And this is how they would actually look. This has a very velvet-like appearance, very velvety touch to them. Alright, now move on to the large intestine. This will begin at the ileocecal orifice, which connects the small intestine to the large intestine, and will continue on through the anus. And of course the large intestine will border the small intestine. Now the functions of the large intestine, the main function is to absorb water. It can also absorb vitamins that are produced by the normal bacteria that are found in your large intestine. And also to compact waste products and package this material in order to be defecated from the body. So the large intestine has a minor role in the digestive process. Its biggest thing is to absorb water. Now, if it absorbs too much, you'll be constipated. If it absorbs too little, then you'll have diarrhea. And there are no villi in the large intestine, so that's why there's so little nutrient absorption occurs here. Here's an image of the large intestine. There's the ileum, the last part of the small intestine, and where it meets the large intestine, ileocecal valve or ileocecal sphincter. The cecum is the first part of the large intestine, where you'll find the appendix. The large intestine will go up, across, then down, and then kind of circle back around, and then out through the anus. Now the large intestine is about 5 feet long and about 2.5 inches in diameter. And then you have the three main regions. You have the cecum, which is the first part, the colon, and then the rectum. The term colon is always a reference to the large intestine. The cecum is a pouch-shaped structure. This is what will receive any undigested food and water from the ileum. Attached here you'll find the appendix, which is about 3 inches long, slender and hollow and dead-ended tube that's filled with lymphatic tissue. The appendix has no real known purpose and may have a lymphatic purpose or may have a role in your immune system. But it's one of those structures that you can live without and not be that big a deal. If this area becomes blocked or inflamed, it causes appendicitis and must be removed quickly or treated with antibiotics. Now some of the water that's used in digestion and some of the electrolytes are reabsorbed here in the cecum. And the water that is absorbed is a relatively small amount, but it is essential to maintaining the normal fluid balance of your body. The colon, there are 4 sections, and the name This section tells you in what direction the material is moving. The first part after the cecum is called the ascending colon, because it travels up from the cecum, going up toward the level of the liver. This will absorb some water. Then it will go across your body in the transverse colon. Then from there it will bend back down again, forming the descending colon. So it will go down near the spleen and then traveling down your left-hand side. And then you have the sigmoid colon, which will extend to the rectum. The sigmoid colon forms an S shape. So going back to this image, the cecum, the first part here, material goes upward, so the ascending colon, it will turn this way, transverse colon, it will turn downward, descending colon, and the last part, this S-shape curve, the sigmoid colon, then into the rectum. Now the rectum is what opens to the anal canal that will lead to the anus. And the anal sphincter is what will open and close to allow passage of feces outside of the body. I'll now talk about clinical application. I'll talk about a colostomy. Now sometimes due to a disease or injury perhaps, a portion of the colon needs to be bypassed in order for surgical repair or allow for that area to heal. So a new opening needs to be made in the colon. This procedure is called a colostomy. Now this may be temporary or it may be permanent depending on the patient's condition. This image has some various sites where you can form a colostomy in various parts of the ascending colon, the transverse colon, parts of the descending colon, and the sigmoid. Defecation. And as the rectum will fill with feces, there's a reflex, the defecation reflex, that occurs that causes the rectal muscles to contract, the anal sphincter to relax. Now, if the fecal matter moves through too rapidly, you won't have enough water that's absorbed. That's when you get diarrhea. And the opposite of that, if fecal matter moves too slowly or takes too long in the large intestine, you'll have too much water removed, then you get constipation. Now, there are two sphincters that surround the anal opening. The internal anal sphincter, which is involuntary, that's something that you don't control. Then the external anal sphincter, which is voluntary. Now, when feces enters the rectum, the wall will stretch, which will trigger the defecation reflex. The walls will contract, then the internal sphincter relaxes and opens. The external sphincter will only relax when you decide to open it. So you have control, within some limits, obviously, of when and how often you defecate. All right, now move on to bacteria. Bacteria in the bowel play two important roles. The bacteria help to break down indigestible materials, and they produce B-complex vitamins, and most of the vitamin K that we need for proper blood clotting. So having bacteria within our intestinal tract is vitally important. All right, now we'll talk about another clinical application. Talk about lactose intolerance. This condition is the inability to digest the sugar that's found in milk and dairy products. That sugar is called lactose. It's caused by a deficiency in an enzyme called lactase. This is found in the intestines. So as a result, the sugar lactose can't be fully broken down and digested. Normal bacteria found in the intestines will use these undigested sugars, and as they do so, will produce gas as a byproduct, causing a very, very uncomfortable feeling of being bloated. And the undigested lactose will prevent normal water absorption, which will cause diarrhea. So those people who are lactose intolerant, if they do eat dairy or milk products, this is why you get gassy, it's why you get bloated, it's why you get diarrhea. Now there seems to be a genetic basis for lactose intolerance. 15% of Caucasians will develop lactose intolerance, while 80 to 90% of African American and Asian populations will develop this to some degree. To avoid the symptoms, patients who do have lactose intolerance need to avoid dairy or take an oral form of the enzyme lactase to help break down dairy products before you eat them. All right, now we'll talk about some accessory organs of the digestive system. Besides the salivary glands we've already talked about earlier, there are some other accessory organs that are needed for digestion, such as the liver and gallbladder and the pancreas. Liver, this is your largest internal organ. It's about 1.5 kilograms, so this weighs about 5 pounds. So not only the largest glandular organ in the body, but the largest organ in the abdominal pelvic cavity as well. Now, the organ will conduct many functions that are vital to life. It'd be very difficult to list every single function of the liver. The liver has two lobes, the larger right lobe and then the smaller left lobe. And then the right lobe has two smaller inferior lobes to it. Now the liver will receive about 1.5 quarts of blood every minute, either from the hepatic artery, which will provide oxygen-rich blood, or also from the hepatic portal vein. So blood that is returning from the intestines before it goes to the heart in a normal cardiovascular system will stop by the liver first to be filtered again. All right, here's an illustration of the liver. You have the two lobes here, the gallbladder found underneath it, the common bile duct, the cystic duct. All right, it's a very short list of the functions of the liver. It will detox the body of harmful substances like drugs, like alcohol. It will create body heat. It will destroy old blood cells and recycle their usable parts while eliminating parts that are not needed, such as bilirubin, which is a pigment found in bile, and also will give color to feces. It will form blood plasma proteins such as albumin and globulin. It will produce the clotting factors such as fibrinogen and prothrombin. It will create the anticoagulant heparin. It manufactures bile, which is needed for the digestion of fats. Even though bile is stored in the gallbladder, it's made by the liver. It will store and modify fats for a more efficient use of the body cells. It will synthesize urea, which is a byproduct of protein metabolism, so it can be eliminated by the body. It will store simple glucose as a modified form called glycogen. Blood sugar levels get too low, the liver will reconvert that back to glucose, so you have a quick source of energy right away. It will store ions, vitamins A and B12 and D and E and K. You can also make cholesterol. And again, this is a very, very short list of all of the stuff that the liver can do. That's why your liver is such a vital organ. All right, now we'll talk about bile. Secretion of the hormone secretin will stimulate bile production, which is a critical liver digestive function. Now, the salts that are found in bile act as a detergent or an emulsifier. They take fat and break them up into tiny droplets. This is called emulsification. This makes the process of digesting these fats a lot easier. Now, the bile will help to absorb fats from the small intestine, and it transports bilirubin and excess cholesterol to the intestines to be eliminated by the body. Now, bile will leave the liver through the hepatic duct, and it will travel through the cystic duct onto the gallbladder until it's stored there until it's needed. It's not secreted until it's told to do so by the hormone secretin. See, the gallbladder is a sac-shaped organ. It's about 4 inches long, located just under the liver's right lobe. Now, while storing bile, it will absorb much of its water content, making it between 6 to 10 times as more concentrated. So if over-concentrated, the bile salts may solidify, as what forms gallstones. So it's bile with too much water taken out. Now, the presence of fatty foods in the duodenum will cause the release of the hormone CCK, cholecystokinin. This release will cause the smooth muscle and the walls of the gallbladder to contract, squeezing bile into the cystic duct, and then through the common bile duct into the duodenum. So it's the presence of the fats that release CCK, which causes the release of bile. All right, now we'll talk about another clinical application, cholecystitis. Stones that are often formed from cholesterol in the gallbladder are called cholelithiasis. These can range anywhere from the size of a grain of sand to marbles or even larger. Now, stones that get lodged in the bile duct will cause severe pain that will radiate to the right shoulder. If inflammation will develop from here, it's called cholecystitis. Now, if the blockage causes a backup of the bile and back into the liver, this can lead to jaundice. So treatment of this condition will include the removal of the blockage of the bile duct either through medications or through shock waves or, if needed, surgical removal. All right, now we'll talk about the pancreas. The pancreas plays a very important role in digestion. It also is a dual function gland. It has an exocrine function and an endocrine function. For this chapter, we'll focus on the exocrine function. It's about 6 to 9 inches long. It's located posterior to the stomach and will extend laterally from the duodenum toward the spleen. And the exocrine portion will secrete buffers and digestive enzymes through the pancreatic duct into the duodenum. This is what the pancreatic juice is. It contains that high amounts of sodium bicarbonate ion to help neutralize the acidic chyme as it enters the small intestine. So these buffers usually have a range up to about 8.8, which will help neutralize the very strong acidity of the chyme, which is between 1 and 2. If you don't have this buffer, you're going to have acid basically tearing away at the small intestine, and you won't have a small intestine for too long. And the secretory action is activated by the release of hormones from the duodenum. Now, the general digestive enzymes of the pancreas, there are several of them. We'll talk about just a few here. The first one, carbohydrates. This will work on sugars and starches. Lipase, this will work on lipids. Proteinase will work on proteins. And then nucleases, these will break down nucleic acids. Here's an image of the pancreas here. You see this one long duct here that runs a full length of the pancreas. That's a pancreatic duct. That's where you'll get pancreatic juice being secreted, where it's all able to merge together, where it's able to be dumped into the small intestine to help neutralize the chyme that just entered the small intestine. Now we'll talk about another clinical application. We'll talk about pancreatitis. And there are some problems that can occur with the pancreas when the bile duct becomes blocked. In some cases, the pancreatic enzymes will back up into the pancreas. As a result of this, these enzymes will begin to inflame and actually destroy the pancreas itself. It's called pancreatitis. Causes of this can also include excessive alcohol consumption, gallbladder disease, irritations that would cause abnormally high rates of pancreatic enzyme activation. If this isn't resolved and resolved quickly, this can lead to death. So this is something that you don't play around with. All right, now we'll talk about some common disorders of the digestive system. All right, they can include some of these. We'll talk about each of these in order. Vomiting, diarrhea, constipation, abdominal pain. See the first one, vomiting. This is a protective mechanism which will rid the digestive tract of an irritant or of an overload of food that stimulates sensory fibers, sending a signal in the vomiting center of the brain. It's basically what your body doesn't want inside it, it's going to get rid of it somehow. And vomiting is one of those methods. Motor impulses that are sent to the diaphragm and the abdominal muscles to contract, squeezing the stomach muscles and the opening of the cardiac sphincter at the esophageal opening, and the material will go back up instead of going forward into the system. They reverse or are regurgitated. All right, diarrhea. This results when the fluid contents in the small intestine are rushed through the large intestine without reabsorbing enough water. So this rapid movement reduces nutrient and electrolyte absorption as well, which can lead to serious problems. So not only are you losing too much water, you aren't absorbing any nutrients either. It's the opposite of that, constipation. This is when feces will move too slowly through the colon, and then you get too much water taken out. So the stool will become very hard and very compact and very dry, and often very difficult to pass. Now, constipation doesn't refer to the frequency of how often that you stool, but instead of the hard consistency of the stool. The peptic ulcer disease. This can affect the lining of the esophagus or the stomach or the duodenum. And the most common region of this is the upper part of the small intestine, or the duodenum. This is caused by an imbalance in the juices of the stomach that produce more acid. Then you get mucus. Because remember that mucus lining is there to protect the innermost lining of this tract. So if that protective mucus layer isn't there, the acids are there to just eat away at the tissue that lies underneath. The main cause of these ulcers is the bacteria Helicobacter pylori. What it does is it opens a wound in the lining of the intestinal, or lining in the intestine, which is made worse by exposure to your stomach acids. Here's an example of a peptic ulcer, basically a hole in the intestine, and this will get more and more irritated as it gets exposed to more stomach acids for a longer period of time. Okay, here's an illustration of how this happens. You get an infection with this bacteria, H. pylori, which will cause an inflammation in the mucosal layer. And then you have the hydrochloric acids and other acids basically eat away at the area around it, causing the ulcer. Alright, in this table we have some pathology of the digestive system, such as abscess, anorexia, bulimia, caries, cholecystitis, cholelithiasis, and their basic descriptions. Now, some of these we've gone over in this video, and some we haven't. Here's some more: cirrhosis, cleft lip, cleft palate, Crohn's disease, diverticulitis, enteritis, esophageal stricture, esophageal varices, fissures, gastritis, gastroenteritis, gingivitis, gum disease, hemorrhoids, hepatitis, hiatal hernia, ileitis, impacted wisdom tooth, inguinal hernia, intussusception, IBS, irritable bowel syndrome, malabsorption syndrome, peptic ulcer, periodontal disease, polyposis, pyorrhea, reflux esophagitis, ulcerative colitis, and volvulus. Of course, this is a very short list of all the various pathologies that you can find within the digestive system and their descriptions. Alright, we'll end this video and this chapter with some points of interest. Basically some key reminders of what we talked about in this video. The digestive tract is a hollow tube that goes from the mouth all the way down to the anus. It utilizes a variety of accessory organs that allow the digestion of food and then also the absorption of nutrients. Food is processed both mechanically and chemically to efficiently break it down. The following are the main components of the alimentary canal and their functions. This is a list of all the structures that we talked about, their digestive activity, the substance that is digested, anything that is required beyond that. Good summary of the stuff that we've talked about in this video. The bulk of the digestive process and the absorption of most nutrients occurs in the small intestine, the most key component of the entire system. Although not directly a part of the gastrointestinal system, the accessory organs like the liver and gallbladder and pancreas are needed for proper and efficient functioning of the system. The rate and the speed that food travels through the system affects the acidity of the digested foods, the absorption of nutrients, and then the quality of the feces. And diseases of the gastrointestinal system can be a result of heredity or by the amount of food that we consume, the type of food that we consume, different substances that we may abuse, or even our emotions. Alright, that brings us to the end on this chapter on the gastrointestinal system. And we will continue our video series with our next chapter on the urinary system.